Welcome to Revital Physical Therapy channel. I am Nav. I am a licensed orthopelvic floor physical therapist. I am here trying to make educational videos for some of the common physical conditions I see at my practice. So stay tuned. In this video, we're going to talk about stress incontinence. Stress incontinence is if you lose urine with physical exertion such as coughing, sneezing, running, jumping, etc. It may be related to hypermobility of bladder or internal urethral sphincter deficiency. It could be weakness or tension in pelvic floor muscles that can happen after pregnancy or childbirth. If your stress incontinence symptoms are due to internal urethral sphincter deficiency, which is, this is urethra where the urine comes out and it is attached to our bladder in here. So internal urethral sphincter is here, and to let the urine pass it has to relax, and to keep you continent it has to stay tight and closed. So if there is deficiency or there is problem in this sphincter that helps to close and open the urethral opening, you can have incontinence. So the causes for the deficiency in this sphincter could be birth defects, or it could be after surgery or radiation therapy. Now, if your symptoms are due to pelvic floor muscle weakness, tightness, or incoordination, then pelvic floor muscle strengthening are proven to be very, very beneficial. A trained physical therapist can first assess your pelvic floor muscles internally or externally or both. If there is tightness or trigger points, tightness is treated first before weakness. It is always a good idea to get it assessed by a trained physical therapist before you start doing strengthening or stretching of your muscles, because if you have tightness in your pelvic floor muscles and you start doing Kegel or strengthening exercises, it can worsen your symptoms. Now, pelvic floor muscle relaxation or lengthening can be achieved by one by manual release by your physical therapist, either internally or externally. A pelvic floor therapist is trained to go through your vaginal opening to go inside and work on these pelvic floor muscles and release any trigger points or tightness in your pelvic floor muscles internal. If a person is not comfortable with internal muscle release, the muscles can be released externally as well. But if you don't have access to a pelvic floor physical therapist, you can do some breathing, relaxation, lengthening exercises at home on your own. So diaphragmatic breathing is a way that you can use at home to lengthen or relax your pelvic floor muscles by yourself. So diaphragmatic breathing helps to regulate the pressure in our abdomen. This is our pelvic floor muscle layer. It's like a sling at the bottom of our abdomen, and this is our diaphragm. So when we breathe in, and we breathe in with our diaphragm going down, and that lengthens and relaxes our pelvic floor muscle. And if we are keeping our pelvic floor muscles tight and we're not doing diaphragmatic breathing, the pressure in this area is, the intra-abdominal pressure is so much that when we cough or jump or run, do all those physical exertion, there's so much pressure that it leaks the urine. So if we learn to coordinate breathing, diaphragmatic breathing, and help to regulate this intra-abdominal pressure, the incontinence symptoms improve a lot. So diaphragmatic breathing is also called belly breathing. That means when we breathe in, we breathe into our belly, sides of our ribs. So one way to learn belly breathing is you can put one hand on your belly and you can put another hand on your chest. And first, let your belly come out, and then it's gonna followed by the chest rise. And when we breathe out, we want to lift our pelvic floor. We want to contract and lift our pelvic floor up, and then release the air out. And when we breathe in, we want to expand and lengthen our pelvic floor, which happens by expanding our belly. And then from the bottom, we push, we breathe the air out. And the another way to do it is also like you can put your hands on the sides of your ribs at the bottom and fill the air, feel your pelvic floor stretched out, and then you tighten the muscles and release that air out. Now let's practice diaphragmatic breathing or belly breathing in laying down. So this is hook line position, and you can put your hand, one hand on your belly and one hand on your chest, and you can practice by taking a deep breath in through your nose and pushing your belly out, like, and breathe out by pushing through the bottom of your abdomen first. And when you breathe in, feel the air going down to your belly and relax your pelvic floor muscles. And when you breathe out, start to breathe out, make sure you tighten your lower abdominals and your pelvic floor and push that air out. Now let's see how to do pelvic floor strengthening exercises or Kegel exercises. So this is when I'm sitting, this is the anal opening, this is our vaginal opening, and our pelvic floor muscles lay right under here like a sling. So to tighten your pelvic floor muscles, visualize like you are stopping the flow of your urine. So you are closing the vulvar opening, you're tightening and closing the anal opening. These are some visualizations, some cues to give to your body to tighten and close your pelvic floor muscles. Now you can hold this contraction for about 10 seconds and do 30 to 80 repetitions, and you can train your muscles for 6 to 8 weeks. But this is not the only dosage. Your physical therapist can decide different ways of doing the exercise, different dosages depending on your goal and what you need. Now this, what we talked about now, is more of an isolated pelvic floor muscle contraction or strengthening, which is important, but it is also important to use this to coordinate this with your functional activities. So you can do contract and relax your pelvic floor and coordinate the contraction and relaxation during a functional activity or sports activity to prevent leakage or incontinence. Now, once you learn the isolation of pelvic floor muscles, you can use it during your functional activities, sports activities, running, box jumping, or other activities that usually cause you incontinence. This is so you progress your exercises from isolation and sitting, laying down, and then with squatting, with jumping. So your physical therapist can guide you how to coordinate these exercises or pelvic floor muscles with your functional activities. If some people have difficulty isolating their pelvic floor muscles, there is a modality called biofeedback that a physical therapist can use to help you isolate your pelvic floor muscles and strengthen it. Managing incontinence requires multimodal approach. So you need to take care of your bowel health, your bladder health, your fluid intake. You need to take care of your constipation, your mental health. So it is really important to take care of your overall health to manage the symptoms of incontinence. Other options to manage stress incontinence are pessary or incontinence ring placement. If that fails, surgery, which may include bulking in case of internal urethral sphincter deficiency, or catheterization. Physical therapy is usually the first line of treatment and is proven to be the most effective treatment option to manage stress incontinence. So, see your doctor or physical therapist to see what your options are. And thank you very much for watching this video. See you in another video. Bye.